Good morning. This is Erin Bickers with the Department of Medicaid. It's not quite 9 o'clock and we're still clearing out the waiting room, so we'll give it just a few minutes before we get started. Hope everybody's staying warm today.
Morning, folks. How we doing?
Morning, Steve.
Good morning.
Steve, it's 9 o'clock and the waiting room is clear. I currently only have the four of you, Van, Steve, Casey, and Kristen. If I missed anyone, please let me know. I believe Nathan said he wasn't going to be able to be with us today.
What's Nathan's problem?
I believe, didn't he email and let us know he was not going to be?
Yeah, I saw him this weekend and he said we got a call this coming week. I'll have to talk to him.
eh,
That's all right.
Oh, here comes Kevin.
Okay. And I heard from Brandon Harley. He can't be here today.
Maybe it was Brandon and I marked the wrong member.
Okay.
I'm sitting here trying to look through my emails.
I barely made it. I had car issues and snow issues and ice issues.
I think there's more issues coming, Steve, from what we hear. So hold on tight.
I'm hoping those issues are weather related, not Steve related.
Right. Yes. The snow and the ice issues, anyhow.
Just checking.
I don't think we even want to go into your issues, Steve.
Oh,
That's
amen
right.
to that.
I think it's the weather component. So
I agree, man.
I'd say we all have our other issues on top of it. Yeah. Especially when you I don't know who all's doing NTI this week at home with the little kiddos, but it makes for a fun start to the year.
Yes.
No, I can't even imagine that.
No.
I
My
feel
wife
your
was retired, went back to teaching, so she's been off. But during COVID, I'd come into work. I was the only one here. I was more isolated at the CARP than I was at home. And she'd be on the phone with the same student every day. I mean, I can remember his first name. Said, "You got to get this work done, but I don't want to do this work."
I feel your pain, Angela.
Yeah.
Steve, your waiting room is clear. If you'd like, I can keep an eye out if we get a
Yeah.
couple more members for a quorum.
Yeah. We don't have one yet. We have four is my number.
I believe we have five. I believe
Okay.
Kevin logged
Okay.
in.
All right. Well, let's go ahead and get started. Have the agenda in front of you. We won't worry about the minutes. I forgot to send those out. I can't find my agenda. So we'll go on from there. I guess it's Medicaid updates. Angela, is that you? Apparently she's doing fourth grade math.
You're on mute, Angela.
Nathan. Yeah, you're muted. And Nathan just
And
joined us. Hey,
Steve, you
Nathan.
also, oh, you have a quorum.
Morning.
Angela joined, Nathan joined, and Adrian is currently joining.
All right, well, let's do the minutes. I just sent those out and I apologize. The highlight of last meeting was Christian Porter. That was so much great information. It was almost, it's more than I could absorb, but it was really great information, and the PowerPoint's useful as well. So we appreciate that. So could we get a motion on the minutes?
I'll make the motion.
Thank you, Angela. And a second?
I'll second.
Thank you, Christian. All in favor, signal by saying aye.
Aye.
Opposed? And abstention. Adopted. Thank you much. Now let's get to the significant stuff. Angela's back with us.
Sorry. There was I didn't want to click. Yeah, want to provide some updates from Medicaid standpoint again, and specifically around the 1115 reentry waiver. I'm trying to think back, right? When was it? November, and the many things that happened between November and the end of the year. It was again lots of things that were packed into the end of the year that typically is over months. So, which was all good things. So we did receive, Kentucky did receive the approval for the broad Team Kentucky extension, and then those pending components that were new components under Team Kentucky. And so that was the middle of December. Which was great news. We are, and we'll talk about that, working on trying to get the Team Kentucky 1115 webpage updated. And again, so I think the approval was posted, but there's many other materials that need to be posted. So bear with us in the first bit here in the next week or two. We're trying to get that updated to make sure all the information's out there. But wanted to share, yes, we did receive that Team Kentucky approval. So that means, again, under Team Kentucky, we now have the existing out-of-state former foster care youth component. So that, again, is if individuals were in foster care in another state, move to Kentucky, they again can receive Medicaid eligibility and coverage and services under that. So that was existing and had been existing. That's just an extension for another 5 years, as well as the SUD 1115 was extended for another 5 years. But under the SUD 1115, we did get the approval for the Recovery Resident Support Service. So again, that was under the Senate Bill 90 pilot program. So that is a new service that will be added to Medicaid as a benefit through the 1115. We again got the
And Angela, what does that service look like or could look like?
Yeah. So for the RRSS, Recovery Resident Support Service, that is not recovery housing. So again, we'll continue to say we are not reimbursing for recovery housing, but it is a service that can be provided. So those support service, necessary support services in the recovery residents to support those individuals, long-term recovery, et cetera. So it can be provided by recovery residents that meets criteria under the definition of the service and the standards that we implement. So they're required to be NARS certified, levels 2 or 3. And then again, there's going to be some monitoring requirements, engagement with the individual, development of recovery plans, again, care coordination components. And so that has actually kicked off through Senate Bill 90.
So Angela, trying to understand this, and we've talked about it before. So if that recovery residence has the ability, they can bill for what, case management, peer support?
No, good ask, Ben. So it's actually a weekly per diem rate that the recovery residents would receive. And so there are within that service definition, those support services are outlined, and we can definitely pull it up and send it to this group too. But yes, those peer services, groups, supports, connection to community resources, providers, et cetera. So the activities, again, that the recovery residents are supporting that individual in their recovery and long-term recovery. And then again, to transition right into independent living.
And if
So
you
it's the service
you all-
that they are providing.
have you all set that bundled rate yet?
We have, so again, the individual can still, if they're in IOP, if they're getting outpatient behavioral health services, they can still receive those services. I don't have it right here in front of me, Van. But we'll pull it up as we move along.
Okay, thank you.
So
It's
is
a-
that in
it's a
effect
different-
now?
It is under Senate Bill 90 only. So
Okay.
even though we have the approval under the 1115, we still again have those deliverables, if you will, that we've talked about through reentry, right, and approvals that we have to work through with CMS and set the implementation plan. So it is currently implemented through Senate Bill 90 and the Behavioral Health Conditional Dismissal Program. So we are working with the Fletcher Group, who's really acting as the administrative service organization currently. So since without the 1115 authority, there was not funding for this, and this is where the MCOs again has supported the implementation of this pilot. And so that funding again is being overseen by the Fletcher Group. So there's not claiming to Medicaid currently. The providers aren't enrolling directly with Medicaid. They're contracting with the Fletcher Group, who's ensuring again through the application process that we're overseeing that they're meeting their requirements. They have the capability. So again, we're trying to build up that provider network through the pilot, and then we'll have to work through the first quarters of this year through that implementation planning to determine how we roll that out through the 1115. Do want to note for those purposes under the 1115, currently only the reentry population. So under our reentry 1115 population, individuals from the state prisons, for example, that are leaving the state prisons, entering the community, are eligible for RRSS. So again, moving into recovery residents, as well as our existing Senate Bill 90 population. So initially it will be limited to these populations till we build the service, the provider network, and then again, we can expand. So I just want to note that for everybody as well too. So that's this again does have a tie to our reentry 1115. But again, it would be for those individuals that are leaving the reentry under the reentry demonstration, transitioning into the community with SUD that would meet their requirements would be eligible for RRSS, and those that are participating or had been participating in Senate Bill 90.
Okay. It was a small rollout initially, obviously. That's okay. Makes sense.
Yeah. And again, we have a large recovery residents network in Kentucky, right? And in many of those initiatives. And so we've worked with Department for Behavioral Health on that. Just scrolling through, I'm not sure if we have any of those folks on the call through Senate Bill 90 to again develop the service. But so they again are overseeing certification, NAR certification. That is one of those requirements. So again, we have a large network, but really trying to establish what the service is, what it's going to look like, and that we are meeting those standards and requirements. And again, you know, what was also, so when we rolled that out, if you will, and developed that, we had the 1115 in mind and what, we felt like CMS would approve. So that was one of the new components approved. And then the reentry 1115, we did receive our full extension and approval. So we had talked about, right, initially in July of last year, we had received just, I think, through what was the previous existing approval of Broad Team Kentucky. So we received, as we expected, that full extension for reentry demonstration. We also received the approval for the pending serious mental illness SMI 1115. So there's, a lot of initiatives across the state and with Medicaid around some of the SMI services. So again, to be transparent and hopefully not to be too confusing, there's the SMI 1915I SPAL and then the SMI 1115. So under the 1115, what the 1115 authority allows us to do was to expand the inpatient hospital stays beyond 15 beds. Very similar to our SUD 1115. So we can again reimburse beyond 15 days in an inpatient hospital for stays for SMI. The other services and expansion and new services around SMI again fall under the 1915I, which can be in a state plan, right? And doesn't need that 1115 authority. So I know that there is a lot of discussion in different areas and different meetings. So just want to be transparent. We're not talking about the approval yet of the 1915 ISPAL. It is the 1115.
But we will be someday.
We hope so. We hope so. But again, I've tried to not be too confusing and transparent. But so that was, and again, all good things. But
What
that
about
will
the implementation plan for the carceral 1115? Have you heard anything back from that, Angela?
anything about the implementation plan on the reentry. And so let's see, that was SMI was a new component. And then the recuperative care pilot, so medical respite. And we also are going to refer to this as a health related social need. So HRSN 1115. So this is a new 1115 to Medicaid. So the recuperative care pilot was also approved as a part of the December approval. And so the medical respite service, again, is for individuals. It can be either post-hospitalization, and it can even be pre-hospitalization. So if there's like a scheduled surgery, if you will, or scheduled procedure. So individuals that are at risk of homelessness or are homeless that need additional recovery time and supports are eligible for this service. And again, it's so that they can receive that recovery care in addition to really that care coordination, case management services to address those health-related social needs for that individual. So it is a primary medical right. They do need to have an ongoing medical need, not primary behavioral health, but knowing that many of those individuals will have behavioral health needs. So again, through that service, ensuring that they're being providers can provide it directly, or again, they can refer if there's a behavioral health need, but we are at least screening for those. And if there's identified need, referring that out to appropriate providers so they can still receive behavioral health services, any primary care services, any other services they need while they are in recuperative care. But again, that allows them the opportunity to have the recovery that they need, in addition to help support and address those health-related social needs. So with that being said, also want to be transparent. We do have a few programs across the state that have been operating the recuperative care programs. And again, those are the providers that will be participating, that we anticipate would be participating in the pilot and the rollout of that. So again, new service, trying to develop that service, establish that service, and then expand. So with all of
We
that,
go back to Van's question on the implementation plan. I want to make sure I understand. No feedback's been received. It was due like end of December, right?
that's correct. So let me jump to, well, I'll do the reentry here if I can next. Just to wrap up all the additional components. So again, everything is approved currently through December 31st of 2029 now. And so those new components, SMI, recuperative care, those new components require implementation plans, monitoring protocols, all the things that we talked about for reentry. So we will be working on those over the next quarter or two to submit to CMS. So for reentry, we did, I think since the last time that we met, we did submit our implementation plan was submitted to CMS the end of October. We have not heard anything back from CMS about that. And again, full transparency, it was a very, very busy quarter for them, working with, I'm not sure if you all have seen all of the approvals that they have posted heading into the new year, but multiple states across the country working with states to get these approvals in before.
Wonder why that was.
So it was a very aggressive timeline for CMS and for the state. So truthfully, I'm not sure. We are working with them on getting our next call set up into the new year. I'm not sure how much that they have viewed and looked at the plans that have been submitted. I think, again, many efforts were trying to get some of those pending approvals through. So no feedback yet on the implementation plan. With that being said, Van, Steve, there was language that was in our approval in our standard terms and conditions. And so that's a pending that we have with CMS that typically there's language that says that the states cannot draw federal match on our services, so we can't implement until the implementation, it says contingent on approval of the implementation plan. So that language was removed from the CMS or from the STCs in December. And so our pending question with CMS, since that contingency was removed from that language, ensuring that we can continue forward in implementation in October as planned. Would something be held up with the implementation plan, especially in the new year in administration? So we're hopeful that, and we believe that's the understanding and that was their intent, so that we continue to move forward as is. So while we don't have feedback directly from the plan, again, I think that is the intent. The monitoring protocol was submitted, I believe, on the 27th of November. So we did meet that deliverable. We also, again, did submit the reinvestment plan to CMS on the 27th of December. So we met that deliverable. And our evaluation design was submitted to CMS on the 27th of December as well. So Mercer is the state's independent evaluator. I think we've talked about that. We brought them on board in November. So that is a requirement, right, to have an independent evaluator of the demonstration. That's something that we want to introduce them to this group as well. We want you all to be familiar with who they are and what their role is, because they, again, will likely be reaching out to some of you all or attending meetings and things like that. That's part of their role. And it was a tight timeline before the end of the year to get them on board and get that evaluation design submitted to CMS. And so we didn't really have an opportunity to make those introductions. But that's something, again, that you should expect over the next few weeks or so, couple months, is again, kind of those introductions, and we can talk a little bit more about their role. So that was completed. And so again, and so just so you all are aware as well, as we do not typically post the monitoring plans, reinvestment plans, those deliverables that we submitted publicly. We share them again, and the teams have input on those. Core teams, internal teams have input on those. We don't typically submit the final version or post the final versions until they're approved by CMS, because there's a lot of back and forth and negotiations. So I know we've gotten some questions about that. And again, just want to make sure that you all are aware. But just as we, move forward into 2025, we again will continue and pick up implementation planning. And so, but it will actually move, more towards design sessions and development. So we're taking a look right now of kind of the broad project plan and timeline, and what those design sessions will look like. Again, and we'll get to this, there was a lot of effort in the last quarter of 2025, really around CAA and that implementation. But as we move into 2025, CAA really will begin to fit more inside of the reentry implementation, if you will. And so again, really kind of try to shift the focus, not that the focus hasn't been on reentry, but really again around wrapping up the implementation planning in the design, and then again what that timeline looks like. So we also,
CAA is the 18 to 26-year-old piece.
that's correct. So that was the Consolidations Appropriations Act, and that requirement to states. So that was passed in 2023 with a 1/1/25 effective date. And then that was where, again, the guidance really was pending for states for the bulk of time, until last summer and even through the fall and in last quarter. And much of the guidance really is still pending with states on that. So we again had worked with our partners. We'll give that update, touch on that a little bit too, but just want to mention to this group, because again, many of you all are also on the Acres Advisory Committee. So we are looking at dates, just so you're aware, to get an Acres meeting scheduled for February. So that should be coming out soon. So just a brief update on CAA, because again, it kind of falls within the reentry project. We did go live January 1st, and so that includes our state prisons. And we are piloting and kind of not piloting, but started with one of our DJJ YDCs, youth development centers. And then again, we'll expand and roll out as we move through 2025. So we did go live January 1st. Kentucky did submit a fall state plan amendment that was required for these services to CMS before January 1st, with a January 1st effective date. However, and I pause, but we still do not have the exact templates that we're supposed to use for that release from CMS. So we will have to make some changes with what we submitted. But we had our first call with CMS this week about that submission. Seems like we were the first and potentially only state that has done that this far. So we are
Good.
ahead in terms of CAA implementation. And so those are all good things, but there's still many things that we'll continue and have to work through in 2025 and really kind of come into the full compliance, bringing on, as many of those programs and facilities as we can. We had started, again, we talked about, I think in our last call, what we were planning to do in terms of outreach and engagement with the jails. So we have, again, trying to engage with them through the association as well. We did send out before the new year a survey. I know we know people don't like surveys, but given that there are so many of them, just trying to get basic information and understanding of what is currently being provided and what are their, infrastructures. So just very basic, high level as we could get. So we did get some responses back from them, but we will continue that all the way through, the first quarter of this year. Also continue with, we had talked about, I think we had talked about kind of piloting with a couple of the jails across the state as can we start with them, right? Can they kind of be the gold star, if you will, on how to onboard and again, be able to connect with the other jails as we move forward. But also just trying to think of opportunities, how to best, is it forums to have with them? Is it through existing, associations? How can we best connect and support them, right, as well? Like it's just going to be very different in terms of what their needs are and what their infrastructures are. So that will be, again, we have initiated that, but will be a great deal of work in 2025 around CAA as well. So again, if there are any jails that, are participating in the TAC, or can we get them to participate in the TAC? Also in, representatives to participate in ACRES. Although the 1115 doesn't directly include them at this point in time, we've talked about this is the opportunity, right? So that we can expand and amend and be able to do so. We need to hear from them, know from them what is going to work and, what isn't, because it's going to look, the model for the jails is going to look different from the model for DOC, is going to look different from the model for DJJ. So those are all things that are continue to occur. We did have one eligible individual that was released from the YDC first site yesterday. Just again, transparent with that. Not much change from what typically occurs in that setting, and for those individuals, again, they were still receiving the services. They again are enrolled in and eligible for the SKY program, so they are receiving those ongoing SKY program case management services, and then again DCBS. So, but again, we'll continue to learn and see what changes need to occur and how we can continue to roll out in 2025. I know that's a lot of information, but any questions?
No
And
questions, but just to say that
any other things going on, but that's
Yeah.
you all have done a great job, Angela, at the end of the year. I know how much you all had on your plate. Very impressive.
Yeah, it's remarkable, really.
I'll echo that, Van. I mean, I've been in so many meetings with Angela and her team, and just watching everything, how it's been organized and all the work that's been put in has been wonderful. So you all have done an amazing job.
Yeah. Very good work.
We appreciate that. And then, yeah, and as you all know, right, things change on the dime, especially with CMS, there's well, you got to do this or you got to do that. So we appreciate the partnership and the support and the help as well, and the understanding. So anything that we've asked from our partners, you all certainly have been able to provide, and help us through that. So thank you.
I always keep hepatitis C on the agenda. If there's no update, that's all good.
No update. I think, oh, one thing that I didn't mention though, Steve, and I think that may play into that. So when we kind of get into, ramping back up, if you will, into the new year, and when we get in some of these design session type, moving forward work groups, we will start to see some more of those sub work groups. And so this could be, again, this is where the hepatitis C, we felt like could be an opportunity that we start to address in, right, that case management service or identification, in that pre-release period, and how to do that. So I think some of those things will come into play. Pharmacy is certainly, there's been lots of questions and things, and will likely be a subgroup. So we'll start to see more of those subgroups kind of come to life, if you will. And so I think, again, that's where we'll have an opportunity to address some of these items.
Good. Thank you much. Questions for Angela? You just take a breath. Good work. All right. MCL updates. Aetna.
Hey, good morning, everyone. Hope everybody's keeping safe and warm. My name is Joy Varney with Aetna Better Health of Kentucky. And we are at the beginning stages of partnering with the Shelby County Detention Center in providing mental health and substance use training for their new crisis intervention team, and for their staff to help better serve those who are incarcerated and those who are re-entering back into the community. So they've requested trainings on mental health awareness, which we have a mental health training, an adult mental health first aid training specifically for corrections officers, that we're currently trying to get that to them. Crisis resolution, suicide prevention. They want to know more about substance use disorder, co-occurring disorder, and also community resource knowledge. And those are really talking about what do the folks who are re-entering back into the community need to help them to become successful. So that can look like work, housing, substance use treatments, and other support. So this is at the very beginning stages. And so we're really happy to be able to partner with the detention center, and hopefully we can partner with more. So thank you.
Good stuff. Thank you. Humana.
Good morning, everyone. My name is Lynn Edwards, and I will be presenting on behalf of Humana. I am excited to provide an update on our reentry program within Humana, as well as our community engagement outreach efforts. For Q4 2024, we have identified 5 members actively participating in our reentry program. Over the past 3 months, we've witnessed a trend. Several of our members that have recently been released, who were not initially identified for our reentry program, have been reaching out to our care management team. So we are really excited about that new trend. For our community engagement team, we had a strong involvement in Q4. We weren't able to present in the last meeting in November, so I'm kind of giving you guys an update. We continue to participate in our monthly coalition meetings and visiting various detention centers, including one in Bullock County. And these visits are very crucial to establishing presence and supporting within the community. We also partnered with Louisville Goodwill on October the 12th. Humana was proud to have a presence and significant at their significant stand down event. And additionally, we have partnered with several of our reentry coalition meetings by assembling reentry bags at specific locations, one being Henderson County Detention Center In those bags, they included personal hygiene products and educational materials that were aimed at supporting individuals as they transition back into society. In November, we extended our efforts by attending the Sterling Healthcare Expungement Clinic in Montgomery County. And looking ahead into 2025, we are currently working on finalizing our schedule for the first quarter. And as we transition back from the holidays, we are committed to maintaining the level of involvement that has proven effective in meeting our needs of our members. So we remain dedicated in expanding our outreach and enhancing our support for individuals re-entering into the community.
Good. Thank you, Lynn. Any questions? Okay, we're at Passport by Molina.
This is Mark Zockham. I'll keep it short and sweet. If there's any questions, Priscilla Schwartz, who is in our community engagement department and oversees most of these, is also on the call. We participated in 13 virtual or in-person meetings in December, including pre-release classes, expungement events, and reentry councils in support of agency and community partners, which included Goodwill, Mountain Care Center, and local and county churches and county jails. I believe that's all I've got today.
Good. Thank you.
Mm-hmm.
United. Anybody from United? Okay. WellCare, Centene.
Good morning to you, Steve.
How are you, sir?
I'm well. So a little bit of a refresher. WellCare, we have these community impact councils, which is something we started a couple of years ago. I'm hearing myself echo. I hope nobody else is. So anyway, where we identify basically like key community leaders, civic leaders, and collaborate or identify a given problem for the given community. And so we assemble this council, Community Impact Council, to try to address, find some solution to whatever the given problem happens to be. So we did this Community Impact Council for Franklin County regarding reentry. It was over a year ago. So it's kind of late 23. And one of the really cool things is most of the other MCOs participated in the council, and Lana from Aetna was very actively engaged. So that was really cool that it was a WellCare event, but we had other MCOs participating. So anyway, the mission was trying to, for Franklin County only, are there barriers, problems that need to be addressed to help facilitate people re-entering society? Are there needs? And so one of the things that came out of it early on was that if you're in the state correction system, you are discharged with, I think it's like a one-pager front and back with all these different resources, phone numbers, websites, links, where to go, social service, health, whatever kind of needs. And so, but most county jails don't do that. I think there are a couple. And so that was early on something that the group identified as a need. So ultimately, the council in late last summer realized that they were duplicating work of another council, the Bluegrass Reentry Council. However, the final meeting, some things that happened. Number one, the Franklin County Health Department committed to creating, well, they already had a resource directory basically for those getting discharged, and to distributing that to the Franklin County Jail, so that individuals that'll exit that jail, they'll have such a resource. Also, both the Frankfurt Police Department and Franklin County Jail were on the participated in the last meeting, and the Franklin County Jail committed to having ongoing community stakeholder meetings like this council had been since it was disbanding, but they were going to do that going forward. The Frankfurt Police Department told everybody, informed everybody about a really cool thing called the situation table. And this is Franklin County. There's 5 other counties in Kentucky that have this. And it's basically, it's a team to identify or to help people in any kind of crisis and intervene. And so literally there is a panel of people. It's called a rapid triage team. So somebody gets referred to the situation table, or of course, they could walk in and ask for help. And so we've got a situation, and so that literally there is a panel. It involves public health, public safety, law enforcement. And so they look at the case, they identify what are the needs, what are the risks here, what are the next steps, who are the other community entities that could help get this person out of crisis, let's intervene. And so anyway, that launched a year ago in December in Franklin County. And so the Frankfurt Police Department was, telling us all about that and say, hey, get the word out, get the word out, get the word out, so that people can be aware of this option. And so one of the other things was the also the Frankfurt Police Department asked WellCare after that. They also have an initiative that I think it's been going on for a couple of years. It's not reentry per se, but it's called Lethality Assessment Program. And it's to identify people who are probably experiencing domestic violence, and it could escalate to potential homicide. And so it's a similar concept. And so this is something the Frankfurt Police Department does. And so they asked us, and WellCare is going to help fund it. And so they work with, the different shelters, community advocacy, identifying ways to get this person out of that domestic, very dangerous situation and protect them essentially. So anyway, that's something that the Frankfurt Police Department also does, lethality assessment program. And so we're going to help fund that going forward. So that came out of the final meeting as well. So, but yeah, and those community impact councils, our whole point is we want to assemble everybody together and kind of find some solutions and then move on. It doesn't go on forever, but in this case, it's good because we do have other, stakeholders involved. Franklin County Jail is going to be doing stuff as well. So that's the WellCare update.
Thank you, Stuart. How many of those councils exist currently?
We have, I don't know if Darren knows, our Senior Director of Member Engagement's on the call, Darren Levitz. I don't know if he knows exactly how many we have ongoing at the moment. He's staying on mute, so he may not know.
Starting to count.
We currently have 6 community councils in place, and over the last 2 years, we have had 14.
Well, there you go.
Good deal.
Thank you, Darren.
Steve,
Yeah.
I believe we have United on. They were just having some issues.
I got that email. She
Okay.
had some issues. Yeah, I was going to go back. Thank you for that, Aaron. All right, United, Stephanie. Susan Lewis.
Hey, Steve, this is Suzanne Lewis.
Hey.
I think Stephanie was trying to come off of mute and it wasn't working well for her. So just a quick update from our side. Right now we have outreach to a total of about 1,300 members. I'm sorry, about 1,000 members. We've reached about 160. We've enrolled 80 members. We've completed HRAs for about 37 members. We had about 45 that declined the services. And then in January, we've had 1 direct referral from the state, and we're still working on outreach for that member. We also wanted to talk about our partnership with Goodwill and the expungement clinic. Our members can go to the in-person program at any one of the opportunity centers, or they can attend virtually. So we've created that partnership. And then this past fall, we had several, health fairs and partnerships with events with groups Recover Together. So we did one in London, Kentucky, and Pineville, Erlanger, and we provided information, referrals for testing, flu vaccines, legal advice, and information. And we partnered with VOA and the groups Recover Together for those locations to deliver different essential items like scarves, gloves, hats, hygiene bags, and so forth. I think that's all. I just want to make sure. I don't know if Stephanie ever was able to get off mute. Those are the highlights of what we've been doing. Obviously, I am speaking for Stephanie, but wanted to make sure you guys got our update.
Right. Thank you for that.
Thank you.
And Stephanie says, that's everything. Thank you, Suzanne.
Okay.
Good work. All right. Round robin member updates. I keep on here the eligibility post release. I have not heard a lot about that. I was at sometime in December, people were expressing that there's still some challenges with that. I try to explain, you know, as I understand it, there shouldn't be, but just so you know, it's I mean, and I don't know if the challenges are specific to the individual or the situation, but just keep it on there. But, you know, it was resolved, so that was all good news. But there's still that concern. And I keep telling people, the reentry waiver will probably solve this problem, right? Is what we're hoping. Any other members have an update? Taking that as a no. Legislative session started, so we'll see. It's really, you know, they reduced the income tax effective next year, or they started that process from 4 to 3.5%. Several bills been filed. We can send an update on bills if people are interested. But you know, short session, it'll wrap up Friday, and then they'll come back in February. And just informational, there is a Kentucky Judicial Commission on Mental Health has a reentry work group. And if you're interested in participating in that, they're open to anybody. Anyone can join just to see what that focuses on terms of reentry as well. And I always include here future agenda items. And I hear crickets, which tells me no one has anything specifically to report. And no recommendations. Obviously, we may get more recommendations. Several TACs make recommendations to the MAC, Medicaid Advisory Council. You know, we're still in the planning phases, and once that goes live, hopefully in October, we may see some different things, and over time, there could be a recommendation or two. I don't know for sure. That is all I have. Anybody else? All right, the MAC meeting is January 23rd, 2 weeks from today. The reentry TAC always gives a report. If some member wants to do that in January, you are free to do so. If not, I'll give that report. And it meets, it's worthwhile hearing what Medicaid's up to. It's the Angela Sparrow report we get across all Medicaid services. And then our next meeting is March 13th. But that's it. Y'all take care.
Thank you. You too, Steve.
See y'all.
Thank you,
Bye.
Steve.
Stay warm.
Thank you, everybody.
Thank
Bye,
you.
everybody.
See you. Thanks, Aaron.
Have a great one.
You too. Bye-bye.